Hey, thanks for watching this video. Every July, a brand new crop of medical trainees join academic health sciences centers all across North America. July 2021 was a particularly exciting time for many because the new crop of trainees had their medical training altered by the COVID pandemic. It's because of that primarily that I decided to make this video for you. This video is mainly for medical trainees who are transitioning into a role of being a team leader on an inpatient medical team. But if you're a patient and you're wondering how things work, this video might give you some insight into that. And if you're a general in an army, this video could be helpful to you as well. So I don't want to start with a downer, but many would say that this video is necessary because of what has been recognized as the July effect. Famous enough that it has an entry in Wikipedia. More unfortunately, this has also been called the killing season. So there are numerous studies in the scientific medical literature that have shown that patient outcomes in the month of July in North America are not as good as they are in other months of the year. And this July effect has been attributed to more junior trainees being in roles of greater responsibility and that having an impact on actual patient outcomes. Up until now, when you're being asked to run a medical team, you unfortunately were fed a bit of a lie that being a great medical doctor is all about having a good differential diagnosis, knowing the best tests to order, and having the best treatments available to you. The bitter truth is that that's a lie. Well, it's not really a lie. It's partly the truth, but the important part that's missing is that being successful in medicine is really very much about managing logistics and administration. And that's what this whole leading a team thing is going to get you into. So it's worthwhile taking a step back and saying, well, what's a great analogy for a medical team? Is it an elite military unit? Is it like running a residential camp with a bunch of campers and, other counselors? Is it like running a political party? Is it like leading a road crew? Unfortunately, in this role of leading a medical team, you have to be a bit of a general, a bit of a camp director, a bit of a political party leader, and maybe a road crew foreman. If you're really unfortunate and the house staff that you're working with don't want to be there, you're a press gang sergeant. What's the role of a manager? If you think about a business environment, the role of the manager is to maximize profits for the company, to generate the maximum amount of work out of your team, and to pay your team the minimum amount required in order to keep them happy. If you then say, okay, well, what are the deliverables of my role as manager of a medical team? The role of the team senior resident is to ensure that the patients get the best care possible. You need to keep your unruly juniors happy. And perhaps more important, you need to keep your consultant happy. What does it mean to make sure that your patients get the best care possible? Well, you need to manage things so that you do arrive at an accurate diagnosis, that you do arrive at effective treatment for the patient. And I think at a more managerial level, you have to make sure that you minimize the duration of stay, but also guarantee a reasonably low bounce back rate. My only comment about accurate diagnosis is that if you don't know why the patient is in hospital by the time the admission orders are written, you should feel like you're in trouble. That's where you need to be more diligent. You need to be more supervisory with your junior house staff. Um, and I would also say that there's two aspects to that. One is why you think the patient's there. The other is why the patient thinks they're there. And you need to understand both of those things. Um, it's important to arrive at a diagnosis, hopefully before the admission orders are written, because an accurate diagnosis makes sure that the patient gets admitted to the right service, and that right service may not be yours. For example, a medical team trying to manage a patient with a small bowel obstruction. One comment about what might be called the bogus consult, bogus meaning I shouldn't have to see this patient. There are really only two types of bogus consults. One is that the patient is really sick and needs really good care, but your team is not the right team to be looking after that patient. And in that case, your job is to try to triage that patient to an appropriate service. The other is that the patient isn't sick and really doesn't need care by you or anybody else there. But keep in mind that there's really only two reasons for a bogus consult. One is that the service that is asking you to see this patient is actually extremely lazy and doesn't want to help the patient. The other possibility is that that referring doc that's asking for your help actually thinks that you can help the patient. I would encourage you to consider that in 99.9% of cases, the latter is true. You are being asked to help because the person asking you actually thinks that you can help. Keep that in mind when you're asked to see patients where it doesn't really make sense to you.